So your back hurts? Of course it does. This really is the most common musculoskeletal condition that we see as orthopaedic surgeons. At any one time, about 10% of us are going to be experiencing back pain. In our lifetimes, almost all of us are going to have back pain at some point. By far the most common cause of this back pain is just simple wear and tear of life. But that wear and tear can present in many, many different ways. I'm Shahid Khan, I'm an orthopaedic spinal surgeon here at the Bajil Hospital in Dubai, and I specialise in treating back pain and back pain conditions. And I'm going to present a small series of talks called the Back Pain Series, covering all things low back, just so that we can all hopefully learn a little bit more about what is a very common orthopaedic condition. So firstly, and by far the most common way that wear and tear presents, is just with simple low back pain. Many of you will be familiar with the sort of aching and stiffness and soreness that you wake up with sometimes, that you get with activity, that you get at the end of a day's hard work across your lower back. Fortunately, most of the time this will settle spontaneously with a short period of rest, maybe take some painkillers, maybe have a very short course of physical therapy, physiotherapy, chiropractic treatment. And I mean short course, often with 2 or 3 sessions, your back pain will settle down and you'll go back to normal activity. But sometimes that doesn't happen, significant back pain persists, or you're worried that your symptoms are not just those of wear and tear. And that's the sort of time when it'd be useful and helpful to see a specialist and have an assessment. So when should you worry? Well, when you come to our clinics, we ask particular questions just to see if there is an abnormal cause for your back pain. Things such as, is your pain waking you up at night? Back pain shouldn't wake you up in the middle of the night normally. Have you lost weight without planning to lose weight? Have you got what we call neurological symptoms? Pain, weakness or numbness in your lower limbs, in your legs? Or have you got a history of cancer, for example? And if any of these things make us think this could be something abnormal, we'll assess you, we'll take a history, we'll examine, and then we'll do some investigations. Most of the time that involves an MRI scan. An MRI scan is very useful because it will help us not only confirm that the problem is just wear and tear and nothing more serious, but it will also help me identify which bits of the spine the wear and tear affects. Because obviously the more precisely we can try and target where your pain is coming from, the more precisely we can treat it and the more chance we have of helping you. So an MRI scan is a very useful tool, and one week we can arrange if you present to us complaining of back pain that just hasn't responded as we'd have expected. We can get patient-specific treatment options. So what options do we have? As I said, much of this back pain is treated with physical therapy. Conservative treatment options with painkillers, rest, physiotherapy or chiropractic treatment. The evidence suggests that done well, this is just as effective as any surgery. In terms of what I as a spinal surgeon could offer, we can sometimes supplement that with some injections. These injections have many purposes. They can be done with local anaesthetic to give some diagnostic information to try and find out where your pain is coming from and to guide further treatment. They can contain steroid to calm the back down, to reduce pain and spasm and give you immediate pain relief within a few days. Or they can be done, and they're usually done, to facilitate the rehabilitation process, to make your back more comfortable so that you can go away, have your physiotherapy, have your chiropractic and get more out of it. I'm a surgeon and there are surgical options for back pain, but they're very limited to patients in very specific situations. And a surgeon can talk you through when surgery may be an option for you. Thank you for listening. If this sounds like something that you're experiencing or would like further advice on, please do come and see us here at the Bajil Hospital in Dubai, and we'd be happy to do an assessment.